Welcome to HMIS 101, Demystifying HMIS. We know that getting started in the HMIS world can be very overwhelming. This session will help you to have a basic understanding of homeless management information systems. Today, you will learn what is HMIS and why it matters, basic knowledge of HMIS software and data, continuum of care connections to HMIS security and privacy, and understanding data quality. The first thing you may be thinking is what exactly is HMIS? HMIS stands for Homeless Management Information Systems, which is a local software solution designed to capture client level information over time on the characteristics and service needs of people experiencing homelessness. This is because back in 2009, the HARD Act came into play, which requires all communities to have an HMIS with the capacity to collect unduplicated counts of individuals and families experiencing homelessness. Most likely, at some point, you have viewed HMIS in action. Now that you understand what is HMIS and where it came from, the next thing you may be wondering is who exactly required to use it. There are four groups using HMIS. HUD's Homelessness Assistance Grants, and those include ESG, which stands for Emergency Solutions Grant, COC, Continuum of Care, YDHP, Youth Homelessness Demonstration Project, and HOPWA, Housing Opportunities for Persons with AIDS. ESG stands for Emergency Solutions Grant, whose purpose is to assist people quickly to regain stability and permanent housing after experiencing a housing crisis. COC stands for Continuum of Care, which we'll go into more shortly. YHDP is the Youth Homelessness Demonstration Project, which is an initiative designed to reduce the number of youth experiencing homelessness. And lastly, HOPWA stands for Housing Dedicated specifically to the housing needs of people living with HIV and AIDS. In addition, other people who are required to use it is Veterans Administration, which also you might hear known as VA. This would include SSVF, which stands for Supportive Services for Veteran Families, and GPD VA, which is Grant Per Diem Projects. The SSVF program has helped thousands of veteran households across the country to stabilize in permanent housing of their own. VA Grant Per Diem projects help to fund community agencies providing services to veterans experiencing homelessness, such as transitional housing needs. Also included in this number is the Health and Human Services, which is HHS. These include PATH programs and RIDE programs. HHS's mission is to enhance the health and well being of all Americans by providing effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. This includes PATH, which stands for Projects for Assistance in Transition from Homelessness, which funds services for people with mental illnesses experiencing homelessness. RISE stands for Runaway and Homeless Youth, in which the Family and Youth Services Bureau supports street outreach, emergency shelters, and longer term transitional living and maternity group home programs to serve and protect runaway and homeless youth. The last group required to use it is any state or local funder that chooses to use HMIS for their funded programs. For example, California grantees of certain housing programs are subject to HMIS requirements in AB 977. Under Assembly Bill 977, the state of California requires grantees and loanees of state funded homelessness programs to enter into HMIS. Now that we discuss which programs are required to use HMIS, the next question you may have is who is using HMIS? HMIS information is being input by individuals working to end homelessness around the country. This includes case managers working directly with clients, project managers making sure all of the parts of the project come together, and even policymakers working to create new policies that could benefit the housing insecure. They all use HMIS in different ways, but all their efforts come together to benefit the individuals experiencing homelessness. Why does HMIS matter? The best way to understand the why is by understanding the primary goal of HMIS, which is to better understand the scope and dimensions of homelessness locally and nationally in order to address the problem more effectively. HMIS allows for providers more efficient and coordinated services. HMIS helps us to see the big picture of homelessness on a local and regional and national level. When we've had a good snapshot of what's going on, we can better analyze the problems and how to fix them. HUD and federal partners use HMIS to better inform homelessness policy and decision making at the federal, state, and local levels. HMIS is here to bring all the missing puzzle pieces together. HMIS also helps to enhance coordinated entry and case management. Using HMIS software aids in managing the flow of information between programs to give clients the best and the most efficient help possible. For example, let's say an organization inputs its data into HMIS. They get an opportunity to receive funding for unmet needs by having its data in HMIS. It will be able to create reporting and figure out what are the most important needs of their clients in real time. There are two ways to understand and view HMIS. HMIS as a software and HMIS as data, as you can see from the visual. HMIS is a local software solution designed to capture client level information over time on the characteristics and services needed of people experiencing homelessness as stated before. That means that HMIS is both the development of shared expectations on data collection and reporting the funnels down from the federal partners to vendors and COCs. And HMIS is the data that are collected locally in HMIS software, reported out locally, and used in various uploads and reports to funders, and those funders receive and use data for reporting to Congress and other partners. A very important relationship you will see throughout the country is between the COC and HMIS. As promised earlier, what is a COC? COC is a continuum of care program which is designed to promote community wide commitment to the goal of ending homelessness, providing funding for efforts by nonprofit providers and state and local governments to quickly rehouse homeless individuals and families while minimizing the trauma and dislocation caused to homeless individuals, families, and communities by homelessness. It also promotes access to and effect utilization of mainstream programs by homeless individuals and families. It also optimizes self sufficiency among individuals and families experiencing homelessness. For example, one county in your COC is most likely a COC. A COC is a group organized to carry out the responsibilities required under the COC program interim rule and compromises representatives of organizations including nonprofit homeless providers, victim service providers, faith based organizations, governments, business advocates, and public housing agencies, school districts, social service providers, mental health agencies, hospitals, universities, affordable housing developers, law enforcement, and organizations that serve homeless and formerly homeless persons to the extent that these groups are represented within the geographic area and are available to participate. Based on the COC interim rule in HARC Act, Homeless Management Information Systems, HMIS, means that the information system designated by the continuum of care to comply with the HMIS requirements prescribed by HUD. HMIS lead means the entity designated by the community of care in accordance with this part to operate the continuum's HMIS on its behalf. The responsibilities of the continuum of care in consultation with the collaborative applicant and the HMIS lead develop, follow, and update annually a governance charter, which will include all procedures and policies needed to comply with an HMIS requirement, as prescribed by HUD, and a code of conduct and recusal process for the board, its chairs, and any person acting on behalf of the board. In addition, the COC is either designating and or operating an HMIS. The continuum of care must 1. Designate a single homeless management information system for the geographic area. 2. Designate an eligible applicant to manage the continuum's HMIS, which will be known as the HMIS lead. 3, review and approve a privacy plan, security plan, and data quality plan for the HMIS. 4, ensure participation of recipients and subrecipients in HMIS. And 5, ensure the HMIS is administered in compliance with the requirements prescribed by HUD. As discussed, HMIS leads play an important part in providing assistance to use the software as well as acting as the authority on technical standards, including security and privacy. Through the oversight of the COC and the HMIS leads published privacy notices at each agency, the website, and their community, so clients are informed about the uses and disclosures of their data. They ensure communities are following all guidelines with inputting and storing data of clients. Within this, one of the most important areas the COC and HMIS lead provide guidance on is the rights of clients. Clients have the right to refuse to provide data to HMIS, and they should still be served by the community of providers if they do. Clients also have the right to review on notices about disclosing their information on HMIS. You may ask yourself, what exactly is HMIS collecting? It collects client level data, which includes things such as client demographics, name, age, and ethnicity. It also takes into account information about the services that are being provided to the homeless and keeps an inventory of the beds and shelters and the housing options that are available. Next up is a brief overview of what data elements are collected. First, we will begin with the universal data elements, in which universal means collected for everyone. These are things that is created at the record creation. HMIS asks for clients' name, social security number, date of birth, race, ethnicity, gender, and veteran status. In addition, at project enrollment, HMIS asks for clients' disabling condition, project start date, project exit date, their destination, relationship to head of household, client location, and living situation. Next is the common data elements. Common means most everyone collects these, though some types of projects and funders don't require them all. This data is collected throughout a client's project enrollment, sometimes at project start, update, and annual assessment and exit. These include income and sources, non cash benefits, health insurance, physical disability, developmental disability, chronic health condition, HIV/AIDS, mental health disorder, substance use disorder, domestic violence, current living situation, which I'll give you a brief introduction into. Current living situation is designed to capture information on where a person is staying at a point in time. It can be updated at each point of contact. It will help communities track where people are, including those who are not assessed or referred to a coordinated entry event. Date of engagement is an engagement date, and it's the date when an interactive client relationship results in a deliberate client assessment or beginning of a case plan. Bed night date is another element, as well as coordinated entry assessment, which is designed to be a flexible data element that collects an assessment date, location, and assessment results. It allows COCs to define their own assessment questions and responses, categorize different types of assessments, such as crisis needs versus housing needs. This element helps communities to understand and monitor the assessment process in more detail as it relates to its participants' outcomes. Lastly is coordinated entry event, designed to capture access and referral events as well as the results of those events. It will help communities understand the events that go into achieving desired and undesired results through the coordinated entry system. Federal partner elements are only required by certain funding sources for the HUD COC continuum of care. That would include well-being, which will be discontinued soon, moving on assistance provided, and youth education status. Also, HUD-HOPA, housing opportunities for people with AIDS questions include services provided by HOPA, financial assistance, medical assistance, T-cell, CD4, and viral load, housing assessment at exit, and prescribed antiretroviral. HHS PATH. Projects for assistance in transition from homelessness questions include services provided, PATH funded, services provided, referrals provided, PATH, PATH status, connection with SOAR. Also, there is HHS RHY, which is the runaway and homeless youth questions, and those include referral source, RHY BCP status, sexual orientation, last grade completed, school status, employment status, general health status, dental health status, mental health status, pregnancy status, formerly a ward of child welfare foster care, formerly a ward of juvenile justice, family critical issues, RISE service connections, commercial sexual exploitation, sex trafficking, labor exploitation trafficking, project completion status, counseling, staff and appropriate exit, as well as aftercare plans. RHSAP Rural Housing Stability Assistance Program asks a U1 worst housing situation. Lastly, VA Veterans Affairs, which has questions surrounding veterans information, services provided SSVF, financial assistance, percent of AMI, last permanent address, VAMC station number, HP targeting criteria, HUD-VASH voucher tracking, HUD-VASH exit information. Every question asked helps have a better snapshot of clients specifically as it pertains to the program type. This information can help create new solutions and have a better in-depth look at homelessness. Now that the information is in the system, it's important to ensure that data quality is high to aid in having reliable, accurate, and timely information. To aid in providing quality data, HMIS data standards were developed to define the data collection point, applicable projects, definitions, and programming of data elements in HMIS implementation locally, which is the software. Universal, common, and federal partner elements are all collected and stored for use and disclosure per the privacy notice. I know that was a lot of information, so make sure to take a moment to breathe. I want you to leave with a few frequently asked questions. Who owns the software? Usually the software company that licensed the software for the COC for HMIS use. Contracts are entered into and managed locally so that any problems with the software itself are resolved by the entity that holds the contract with the software vendor, usually the HMIS lead. Who owns the data? We all ultimately own our own data, but the privacy notice ensures that the uses and disclosures of data by the HMIS leads and COCs are done with client knowledge. The privacy notice is intended to transfer some responsibility for the data to the HMIS COC from the client. The software contract is intended to transfer some responsibility for the data to the HMIS software company. Data is stored in HMIS, used for reporting, and should be discarded after 7 years of inactive status on HMIS servers. How do I get help? HUD tries to maintain a contact list. At the address below, you can reach us at the hudexchange.info/grantees/contacts. Need additional resources? You can also contact us at the email ab977_ta@abtassoc.com. Also, here is a link to the very helpful data dictionary to get to know more about HMIS data. Thank you and have a wonderful day.